Coronary heart disease refers to a narrowing of the coronary arteries, the blood vessels that supply oxygen and blood to the heart. It is also known as coronary artery disease. It is a major cause of illness and death. Coronary heart disease, CHD, normally happens when cholesterol accumulates on the artery walls, creating plaques. The arteries narrow, reducing blood flow to the heart. Sometimes, a clot can obstruct the flow of blood to the heart muscle. CHD commonly causes angina pectoris, chest pain, shortness of breath, myocardial infarction, or heart attack. CHD is the most common type of heart disease in the United States, where it accounts for 370,000 deaths every year. Fast facts on coronary heart disease. Coronary heart disease accounted for 23.5% of all deaths in the U.S. in 2008. According to the Centers for Disease Control and Prevention, CDC, about 735,000 Americans have a heart attack each year. Warning signs and symptoms include chest pain or discomfort and shortness of breath. Examples of coronary heart disease include angina and heart attack. What is coronary heart disease? The heart is a muscle, about the same size as an adult human fist. Blood is pumped from the heart to the lungs, where it collects oxygen. This oxygen-rich blood is then pumped back to the heart and then to organs throughout the body through arteries. The blood then returns to the heart through the veins and is pumped to the lungs again. This is called circulation. Coronary arteries are the heart's network of blood vessels. They exist on the surface of the heart, and they supply the heart muscle with oxygen. If the coronary arteries narrow, the supply of oxygen-rich blood to the heart may become too low, especially during physical activity. At first, this reduction in blood flow may not produce any symptoms, but as fatty deposits, or plaques, build up in the coronary arteries, signs and symptoms may emerge. What are the causes of coronary heart disease? CHD is believed to start with injury or damage to the inner layer of a coronary artery. This damage causes fatty plaque deposits to build up at the site of the injury. These deposits consist of cholesterol and other cellular waste products. The accumulation is called atherosclerosis. If pieces break off or rupture, platelets will clump in the area, attempting to repair the blood vessel. This clump can block the artery, reducing or blocking blood flow, and leading to a heart attack. Symptoms of coronary heart disease. Angina. The following are symptoms of angina. Chest pain. People describe it as a squeezing, pressure, heaviness, tightening, burning, or aching across the chest. It usually starts behind the breastbone. The pain often spreads to the neck, jaw, arms, shoulders, throat, back, or even the teeth. Related symptoms. Other symptoms include indigestion, heartburn, weakness, sweating, nausea, cramping, and shortness of breath. There are several main types of angina. Stable angina. In this type, the discomfort may last for a short period of time, and it may feel like gas or indigestion. It happens when the heart is working harder than usual, such as during exercise. It has a regular pattern. It can happen over months or years. Rest or medication can relieve symptoms. Unstable angina is often caused by blood clots in the coronary artery. It occurs at rest. It is surprising, it lasts longer, and it may worsen over time. Variant angina. This type occurs at rest, and it is usually severe. It happens when there is a spasm in an artery that causes it to tighten and narrow, disrupting blood supply to the heart. Triggers include exposure to cold, stress, medicines, smoking, or cocaine use. Shortness of breath. Dyspnea. CHD can lead to shortness of breath. If the heart and other organs are getting too little oxygen, the patient may start panting. Any exertion may be very tiring. Heart attack. Heart attack, or myocardial infarction, happens when the heart muscle does not have enough blood, and therefore oxygen. The muscle dies, and a heart attack occurs. A heart attack commonly occurs when a blood clot.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors